Good morning, everyone. Thank you to have answered present to this Vuga show, which will be a series for the other Vuga show that's going to take place till the USC Day. So we're going to have another one for World AIDS Day. After we're going to have another one for the International Human Rights Day, and you end up for UHC Day. So thank you, everyone, to have answered present to this particular show. You're going to have a brief on the AMR, antimicrobial resistance and its threats to global health. And today, as the objective of this show actually will be to highlight urgent the urgent need to address antimicrobial resistance and the critical role of civil society organizations in promoting responsible antimicrobial use and strengthening health system in Africa. So today you have two important guests. We have a Reverend Jane Ganga, who is the Policy Advocacy Officer, Ecumenical Pharmaceutical Networks, and Fitsum Ale Mayeyu, who is the African Union Liaison Manager for working actually with Waki Health. So over to my two guests to actually present themselves and talk about the role they have in health financing and advocacy. Over to you, Fitsum.
Hi, Daryl. Can you hear me?
Yeah, I'm getting you well.
Great. I lost you for a bit. May I kindly request if you can rephrase?
Okay, I just did a brief introduction concerning the reason why we are here, which is actually to talk about antimicrobial resistance. I presented that we have to today two important guests. So you have you, which is who is the African Union Liaison Manager for working actually with Waki Health, and Reverend Jane Ganga, who is the Police Advocacy Officer in the Communica Pharmaceutical Networks. So I just give you the floor to talk to say a brief on your role in health financing and advocacy and to present yourself to our audience today. Thank you.
Oh, thank you very much, Daryl. Apologies, there might be some internet challenges, so I'll do my best to stay on the call. The name is Fitsum Lagao. I work with Waki Health as the African Union Liaison Manager. I also coordinate a civil society platform called the African Civil Society Platform for Health. We do a lot with the African Union, especially on health financing advocacy. We sit in multiple technical working groups in the High Africa Leadership Meeting Declaration Technical Working Group, and also part of the Private Sector Investment in Health Working Group, and also working with the AUDA NEPAD in the Africa Medicine Regulatory Harmonization Framework, and also to see how we can further engage civil society and communities into those policy processes. Thank you.
Okay, thank you very much. Just for our audience, today we have Fitum that was presenting himself. Actually, the liaison manager of for the African Union working with Waki. If for people that don't are not really aware, a liaison manager is actually an individual employed to establish and facilitate relationship between two organizations. For this particular concerning pertaining specifically to Fitsum, he's working actually with the African Union and Waki Health, so he help facilitates the transfer of information maybe from the African Union to Waki or from Waki to the African Union. That's actually what he does in as a small brief. I'll just hand over to Reverend Jane Ganga that will just gonna say a brief on concerning what she does and her role in financing and advocacy. Thank you. Over to you, Reverend Jane.
Thank you, Darren, and it's a pleasure to be in this Vuka show. I'm Jane Nganga. My role at Ecumenical Pharmaceutical Network is I'm in charge of policy advocacy, and across all the programs, I advise on how advocacy work is done. So I represent the Ecumenical Pharmaceutical Network, which is a Christian non-profit organization. Then its work really is around supporting the church health systems and communities to improve access to quality pharmaceutical services. And we work mainly with faith-based health facilities and faith-based drug supply organizations and faith leaders across multiple countries. And we are in 38 countries, and within African region, we are in 27 countries, and focusing on strengthening the healthcare system and advocating for better pharmaceutical products and even policies. And EPN has over the years been involved in addressing antimicrobial resistance through our networks of healthcare facilities and partnerships with various stakeholders. And I'm really excited to be here, really to address this very pertinent issue of antimicrobial resistance. Thank you, and over.
Okay, thank you very much, Reverend Jane, for your brief presentation. Before going to the question and answer part, please, for people getting us, if you have some questions, you can just put it kindly in our chat for our guest today to answer at the end. So, just as a continuation, we'll just go continue with Reverend Jane with the first question of today. She that has been working with antimicrobial resistance in her organization. The first question now for today will be: how has AMR impacted health financing, public health in your country, public health and healthcare system in your country, Kenya? Over to you for this first question. Thank you, Reverend J.
Thank you so much. As I said earlier, for EPN, we work across multiple countries, and therefore I'll be looking at the impact of AMR or as a public health, threat, and especially to the health system, but also the economic burden of it. So looking at it from the clinical impact, what we have observed is that there is increased treatment failures in common infections, and that in essence leads to increase in terms of the cost of treatment. There is also, from the clinical point of view, longer hospital stays and higher mortality rates, and we know that when one takes longer in hospital, of course the cost goes high, both for the hospital but also for the individual, because of the burden of, especially within the African context, of paying out of the pocket. There are specific particular challenges, especially in treating TB and HIV, and of course also malaria, when you look at it from a resistance point of view. That for someone, for example, posing with a challenge of TB and fails in treatment, they are put on the next line of treatment, and ultimately when they get to what we call the multiple drug resistance level, it becomes very, very expensive. If you look at it also from the economic burden, the higher treatment costs, of course, due to the second line, the third line, antibiotics, both, for example, for HIV and TB, that really becomes very costly, even for our economy or our economies in Africa. There's also increased financial strain that we have seen on the church health facilities, again due to AMR, and from the patient point of view, the greater burden because of the paying out of pocket. There are also challenges or impact of AMR on the healthcare system, the strain on laboratory services because of the need to have proper diagnosis. There is also additional burden on already limited healthcare resources. So the healthcare system is really strained, and there is also increased need for infection prevention and control measures because of AMR within the hospital setting, and therefore leads to increase in terms of the utilization of the limited resources. So if we look at it from a wholesome point of view, there's a huge impact of AMR on the public health, from clinical, economical, and also from also the healthcare system itself. Thank you.
Okay, thank you very much, Reverend Jane. From what you said, we have seen that this AMR actually has an effect, be it on disease treatment, hospital burden, and community health outcomes. So it's something that is really multilateral in terms of effects. So that actually brings us to our next question. That will be: what are the strategies in order to create more awareness of this antimicrobial resistance and the use of and the responsible use of antibiotic? Over to you, Reverend Jane.
We need to really ensure that we are having, strategies for especially public awareness. And EPN has implemented and observed several effective strategies that have worked over the years. One, we are utilizing the faith-based approach, where we are utilizing the church networks for community education. And we've been working with faith leaders and ensuring they become AMR champions, and using congregational platforms to enhance public awareness. We are also incorporating AMR messages into congregational health ministry activities, just to ensure that there is that sustainability in terms of public awareness, and really people are getting the message. The other effective strategy that we have used is community engagement, where we are working in the various hospitals and faith-based facilities. We are working with community health workers and really ensuring that that message gets to the household level. We are also conducting a lot of awareness campaigns in schools, and as I said earlier, in churches, and also using local media and social media to enhance the information among communities. We have also enhanced collaboration with youth networks, because we know that young people utilizing the social media platforms can really create a lot of awareness with our youthful generation, and especially because they are the majority even within our continent. The other piece that we have also seen work is working with healthcare providers to enhance education. So regular training for healthcare workers. We usually have an online course, and we have an online course on AMR, and just ensuring that they are getting information and transferring this information to the patients as they come to hospital. And the other thing that we have also done in terms of healthcare provider education is development of antimicrobial stewardship programs that really ensure that there is proper utilization of antibiotics, and that these programs are leading to proper stewardship. And then there has also been the establishment of guidelines for prescription practices, just so that we ensure that some of these practices are being utilized and articulated even at the facility level. So ours has been an approach where the strategy is looking at the faith-based approach, community engagement, and also healthcare provider education. Thank you.
Okay, thank you, Reverend Jane. Thank you very much for your insight. It was very clear. We have had a clear view on actually what is actually the impact of this antimicrobial resistance on our public health, on our health situations, and equally the strategies that have been put in already in order to combat this resistance. So we now go over to Fitsum, who is our liaison manager working with the African Union, to actually talk a little bit on the role of civil society in the fight against antimicrobial resistance, and equally can give some insights on the different policies that can be put in place by the civil society organization. Thank you very much. Over to you, Fitsum.
Thank you very much, Daryl. And I would like also to appreciate Reverend Jane's point in giving us a broader picture on AMR, and also what EPN is doing with our partners as well, especially in bringing the knowledge and also the expertise to communities and health workforce. So the role of civil society, and especially communities in AMR, would be very important, especially one in preventing what we have seen Reverend Jane's presentation earlier, like the socioeconomic impact, the health impact, and also the cost associated with that. And very much also making sure that the prevention starts from a knowledge whereby communities and civil society are very much aware of MR, the key drivers to MR in terms of policy, what really drives, especially looking into substandard and falsified medical products. So that's very key. The other one would be also to make sure there is universal access to wash and also waste management. This can be effectively done by health workers, and also making sure that there is an up-to-date and a sustainable community engagement mechanism in terms of doing that, and also definitely having a community monitoring around it. The other one will be also to access to vaccine and also expanded immunization programs. This is also another preventive approach that civil societies and communities can very much support initiatives ongoing. The other one would be also to push for universal access to affordable quality diagnosis and also appropriate treatment of infections. So this one very much, especially avoiding medicines over the counter, making sure that even local pharmacies are very much ethical oriented in terms of providing medical medicines to their customers. So usually making sure that there is that monitoring, especially doing a routine check in local health providers, pharmacies and such, so to ensure that over counter medicines are not the way forward as well. The other would be strategic information, and also science and innovation. Very much communities and civil society should engage in scientific approaches as well. At the end of the day, the demand for medical products is with communities, and definitely communities and civil societies have the power to shape the demand, have the power also to make sure that quality is also very much adhered to. So, in addition to that, also to bring the private sector to engage here, definitely, and making sure that there is what we call the private, public, and community partnership in addressing AMR. So this goes along the chains of the intergovernmental institutions such as the African Union Commission. There are different policy provisions around it, and definitely we have the antimicrobial resistance political declaration that just came out this year, which is also a binding document that communities and civil societies can use to bring and strengthen the efforts around combating AMR. Thank you.
Okay, thank you very much for your brief insights. We have gotten, concerning what you said, many thoughts, be it community-led monitoring, be it the engagement of private sector in the fight against AMR. So that actually brings us to our next question. That will be, what are your thoughts concerning the One Health approach and cross-sector collaboration in the fight against in addressing AMR? Over to you, Fitsum, for some insights. Thanks.
Thank you very much, Daryl. Here, it will very much bring me to a conversation around effective governance and accountability mechanisms, because definitely cross-sectoral collaboration would very much rely upon governance and very effective accountability mechanisms. So there are different guiding documents that we can use to make sure that we have cross-sectoral collaboration to be effective. And also within that, we have financing, we have community engagement, we have political leadership, we have parliamentarian engagement. So we need more of a wide approach or a system-wide approach whereby we can bring the different actors in one room or in one decision-making space. And here still communities and civil societies play a big role, especially in bringing the face to the problem we have. So usually we have the data, we have the numbers. However, we need face, we need human stories in this data. So definitely also bringing the affected communities and also making sure that the rest of the community also understand the pain, the loss, the economic loss, the social loss, and also the different problems society is facing in Myanmar. So definitely a cross-sectoral collaboration would engage the bureaucrats in the offices, the politicians in the parliament, development partners, and also making sure that research, especially in terms of fighting substandard and falsified medical products, is also adhered to, and very much also to bring into light what we call a black market medicine into light as well. Definitely, for the issue of antimicrobial resistance is not also far from the border issues as well. So usually, substandard and falsified medical products find their ways through porous borders. So even there, we need to strengthen our accountability and governance mechanisms. Over.
Thank you very much, Fitsum. That was actually a very, very powerful for information. What we retain here is that we have the figures, we have the numbers. Let us just put some faces on these numbers for us, for our advocacy campaign to be more successful. That's what you can retain from what you said. So this question actually goes for to you and Reverend Jane. And the question goes like this: what impact do you actually hope increased attention to AMR will have on the health and well-being of communities across Africa? Just in one sentence, actually, what impact do you actually want to have if you address more the question concerning AMR? Over to you. You can just start after you give the floor to Reverend Jane.
Okay. I'm going first, or is it for Fitsum?
No, no, you're going first, Reverend Jane. What is the impact
Oh,
do you want to actually to see in while you are thriving on AMR, while you are
okay.
addressing AMR on health? Yeah.
Yeah. So for me, what would be like, the ultimate hope is that all these collective efforts on AMR within the African region will see every healthcare facility practices, responsible antimicrobial use. Because working within that space of healthcare facilities, it is very important that these practices are, there is responsible use of antimicrobials. Then the other impact I would want to see is that every community understands its role in fighting AMR. I think there is a big dislink between policy and practice at the moment, and we really need to bring that closer. We link the policies and the practice. Every community should understand its role in fighting AMR. And of course, ultimately, we need every life to be protected from the threat of, resistant infections. And of course, as we do all this, we must ensure that, our governments are increasing, resources for enhanced implementation of AMR initiatives, and also the implementation of national action plans.
Okay. Thank you very much. I think you actually went out of time. Thank you very much for our two guests, Reverend Jane Ganga and Fitsum. Okay. Today we just as a hopeful impact, we actually want to want every actor to understand its role in the fight against AMR. I think that's actually gonna be the conclusion remark or the concluding remark for this particular show. Thank you very much for your time. I hope you have been able to give some clear insight on what is AMR and its impact and the role of civil society in the fight against AMR. So that notwithstanding, we'll just say see you next week for our next Vuga show that will actually call on the so we're going to give some brief insights on World AIDS Day, particularly. So over to you and see you next week. Bye.
Thank you. Bye.
Okay, thank you very much.